Hi, my name is Amanda I am a student at FIU. I did my practicum in fit therapy. I'm a student trying to go into PT school. I'm trying to become a doctorate in physical therapy. I've already done some kind of hours on my own just to see how the therapy world is and if I would actually like it. So I kind of already had some type of experience when I came into this, but I'll be talking about my experience with fit therapy overall. So this is the site. It's Fit Therapy. They only have one location at the time. It is located at 7401 Miami Lakes Drive, Miami Lakes, Florida 33014. They are in PTOT, so it's physical therapy and occupational therapy clinic. It's the waiting area where patients usually will be waiting, as they would be welcomed in by me or one of the PTs. As you can see, that is Herbie. This is the front desk where they check in. Then here is the OT, which is Erica and Roxy. Roxy is the intern, Erica is the OT. So then we would be going into the tables, which is where patients usually get hot or cold packs, manual therapy, and then as you can see there, the ultrasound machine, which I would be showing after how it's actually used. I'm here turning it on beforehand. Now, I would be going into where the patients are working out, where they usually do their workouts, and safe environment workout. There is a stationary bike where patients usually warm up. There's another stationary bike. As you can see here, there's where Herbie works, does his notes, and is able to take care and eval patients. That is a short table just in case there's an elderly person that it's very hard for them to get on the high tables. Now we would be going into the back room where it's the hot packs, which also will be showing out after how to use them. So there's the hot packs. Now here's the fridge where it's the cold packs. These are the cryo balls, which is also another thing that I would do on patients. And here's the laundry for the towels. So there's the other stationary bike, the bathroom, and here is the massage therapy where we usually put our things, but the massage therapist comes in every once in a while. And yeah, this is the location with all the workout stuff. And here I am describing the ultrasound and stim machine. So there's ultrasound, there's a combination. We usually use electrotherapy, interferential, or the Russian is what we usually use. I would also be showing you how we get into the ultrasound machine, which is another thing that we usually use, the combination. Now this is where the hot packs are being put together. So this is a cervical, which is what we usually use. Lumbar is for backs. So here I'm taking it out with some thongs, placing it inside neatly. We put a towel just to make sure that the patient isn't burned, and we usually locate it on the shoulder or on the cervical area neck. My site supervisor was Herbie. He is amazing. He actually tried teaching me a lot more than what I already knew, based on how to take notes, how to get to know the patient a lot better, how to actually know what I need to know before I even attend a patient, which is something great. He's amazing. He is up for any question that you ask. He's always there when you need him. He is honestly the best site supervisor I think I could have gotten, in my opinion. And I also worked with a PTA called Jose. He's also great. He's up for anything, super knowledgeable. Also as Herbie. Herbie knows anything and everything that you pull his way. And if not, he's open for anything. They're both open for any opinions you have or any insight on any workouts or anything like that, or any stretches. They're up to try it out to see if it works. They're open for any opinion that you have, which is great, which I love, because there was a lot of times that I would see them like stretching a patient or like doing something to a patient. And I was like, I've kind of seen something sort of like that in my past experience, but why do you do it that way? And then I'll show them the other way that I learned, and they'll be like, oh, that's also good. And like sometimes they'll use it, sometimes they won't. Also with workouts, they want you to be very involved, which I love, which I lacked of a little bit in the beginning, but I pulled myself together and I was able to give a helping hand in the end. For the schedules and hours available, they're honestly open from Monday to Friday, 8 to 7. So they're open for anything. They always have lunch from 1 to 2, and depending on how the patients come in, if they even come in, if they cancel, it just depends. But their hours are very open, very manageable, and you're able to work whenever you need to work. What I learned by completing this practicum was a lot, actually. I learned a lot of new workouts, a lot of new ways of stretching. I also had Herbie give me some injuries to like look into, because I asked for it. One of them was the ACL, which I didn't know there was different ways of going into the surgery and different ways of how to go to therapy when it comes to different types of surgery on the ACL. I also did Parkinson's, which I didn't believe that Parkinson's was something that could go to therapy for, but you could actually go to therapy for Parkinson's disease just to like manage it a little bit more. I was able to work with a patient that had Parkinson's, adorable little old man, notes on how to take notes. I did already have a class that touched up on soap notes, if anybody really knows about that, and that's how usually notes are being made for patients. In this practicum, my overall experience, great. Loved it. At Fit Therapy, they're amazing. I've done hours beforehand in another location. I loved it. The reason why I did that, the CFPT was the right place for me. But going into this site, it opened my eyes to a lot more. I loved it. They wanted you to be super involved. They helped you out with any questions. I always had questions about the notes. Why did they put this? And what does this mean? All of that. And they'll like help me out and they'll teach me and all of that, which is honestly what I love, because I was able to learn something that I thought I was going to have difficulties in the future with. I was able to do a lot on site. I was able to work with a patient. The only thing I think I wasn't able to do was give manual therapy, and that's because there's techniques to it that you need to learn. I wanted to be more involved in that, but then again, they're doctors, they have their experience. I'm still a student, so hopefully I'll be able to do that going into DPT school. Honestly, what worked for me, what would I do differently, and what would I do the same? I'll do everything the same. Everything usually worked for me. But what I do differently, I feel like I would be more involved in giving my opinion and recommendations of how to work out or stretch, which I regret that I didn't. I started doing that in the last 3 or 4 weeks. I learned a lot more in the last couple weeks than the beginning because I was scared and I held myself back a lot in that point. With Fit Therapy site, I'm super happy about my choice. I love it. It was great. They're super family oriented, open arms. Recommendations I'll give to future students: be involved, ask questions, give recommendations and opinions about stuff. Don't be afraid, don't hold back. They're super understanding. They explain everything about everything. But yeah, enjoy with the practicum, take it to your benefit, and learn as much as you need to learn.